those central teams. Remember those central teams that had been sent to the states most affected by the spread of the coronavirus in the second phase? Well, they've submitted their review report highlighting their major concerns, and the Health Ministry has written to the states depending on the feedback that has been given. Let's go across to Sukirti Dwivedi. She's monitoring this story closely. Sukirti, so what were the areas of concern highlighted by the central teams about these states?
Well, yes, if we look at the feedback that has come back from these central teams, so a total of about 50 teams had been sent to 50 districts across Maharashtra, Chhattisgarh as well as Punjab. If we talk about Maharashtra, the worst affected state, then there are at least 30 most affected districts where these central teams had been sent. Some common factors that have been highlighted by the central teams are that containment measures were not being implemented properly in districts like SATARA, SANGLI, AURANGABAD. Testing capacity was an issue in places like Bhandara and PALGHAR. Apart from that, occupancy rates of available hospital capacity were very high in Ahmednagar, Aurangabad, Nagpur. Medical oxygen supply an issue in places like Palghar, Osmanabad, Pune. Malfunctioning ventilators reported by teams from Satara and Latur districts, and shortage of healthcare workers reported from teams in Aurangabad or Yavatmal. So certain common factors, problems in testing, problems in healthcare workforce, all of these issues have been highlighted by these central teams. They will continue to inspect other areas of Maharashtra as well. They will continue to send their feedback, but since the situation is so intense at this point of time, the center is not losing any time. As soon as they are getting any reports that are being submitted by the central teams, immediately all of that feedback is being relayed to the state health departments to ensure that all of these issues are addressed immediately. All corrective measures are being taken. Two similar letters have been written to Chhattisgarh and Punjab as well, and there are also similarly problematic districts, places like Roopnagar in Punjab, places even several parts of Raipur in Chhattisgarh, where issues have been found out with lack of testing facilities. All of these things have been raised in this letter by the Union Health Secretary, and state health departments are supposed to take immediate action to correct these issues.